Hi folks, my name is Dr. Aubrey Tager and I'm a board certified chiropractic physician and a board eligible chiropractic neurologist. I trained under Dr. Ted Carrick, who's the world's foremost authority in chiropractic neurology. He was the doctor who recently got the NHL's Sidney Crosby back on the ice after he suffered a severe concussion. Now I interact daily with a group of over 1,000 doctors throughout the country focusing on functional neurology or brain-based therapy. This group, known as the Johnson Neurometabolic Supergroup, can be viewed by going to www.lifechangingcare.com, where you can see testimonials from across the country. Today you're watching this video because you or someone you love is suffering from vertigo and nothing you've tried so far has worked. Now in our office, we're different because we treat you both neurologically and metabolically. We leave no stone unturned. Most likely, you've seen other doctors about your dizziness or balance problems and have not had any long-term success. According to the Vestibular Disorders Association, both vertigo and dizziness affect millions of people around the world. More than 90 million adult Americans have experienced dizziness or balance problems. Balance-related falls account for more than 1/2 of the accidental deaths and 75% of ER visits in the elderly population. Now, in the last 10 years, diagnosis and treatment of vestibular disorders has changed dramatically. Many other symptoms may now be associated with vertigo, including difficulty writing, reading, and visual changes. These visual changes may include poor depth perception, increased night blindness, sensitivity to flickering lights, as well as hearing problems like crackling, popping, and ringing in the ears. Many times a patient may also be diagnosed with a disease called Meniere's, which is a combination of dizziness, loss of hearing, and ringing in the ears. There are two types of vertigo: ergocentric vertigo and geocentric vertigo. Geocentric means that you are feeling as if the room is spinning, and ergocentric means that you feel as if you are spinning in the room. These are both associated with lightheadedness. Now, you may have been treated by your family doctor with medication like meclizine. Many medical diagnoses of vertigo include an inner ear problem, which generally leads to a diagnosis of BPPV, or benign paroxysmal positional vertigo. Balance is not just related to the ears. There are many other areas to look at as well. The brain, basal ganglia, and the cerebellum all play vital roles in vertigo and balance problems. Now, the inner ear and the cerebellum are connected by the vestibular branch of the 8th cranial nerve. So unless the cerebellum is treated, you'll never get better. When we treat you neurologically, we may use a variety of methods to stimulate, for example, the cerebellum. We may use manipulation to one side of the body. We may also use what's called a caloric in the form of warm water or warm air into one of the ears, which is also going to stimulate the cerebellum. Because what this does is it causes endolymph, which is the gelatin-like substance inside the ear. That becomes warm and liquefies the same way Jello does. When this endolymph is liquefied, it stimulates the hair cells, and these fire and send signals back to the cerebellum. We may also use some things like vibration therapy to stimulate the cerebellum. We may have you doing eye exercises or use an upper body ergometer, which is also a very powerful stimulant to that cerebellum. So if you've already seen your general practitioner or a neurologist and you've had CT scans or MRIs, and pathological lesions like tumors and strokes have been ruled out, and you are still suffering from the effects of BPPV, then you've definitely come to the right place. Aside from treating you neurologically, we're going to treat you metabolically as well. Well, what does that mean? Well, we're going to order different lab work, including blood work, and when we do that blood work, we're going to be looking at your thyroid, your metabolism, your lipid panels, and we're also going to look at things like your adrenal glands. When we have added stress in our lives, be it emotional, physical or chemical, we cause damage to our adrenal glands. And our adrenal glands, in response to this added stress, is going to release cortisol. The problem with cortisol is it's toxic to the brain, and it's going to cause an inflammation in the body and the brain as well. And then what's going to happen is you're going to experience neurological symptoms like dizziness if your cerebellum or other parts of the brain are affected. Other factors that may be causing inflammation and possibly making vertigo symptomatology worse include food sensitivities. So we're also going to run some food sensitivity tests for foods like eggs, yeast, soy, and gluten. You see, unlike some other healthcare providers, maybe even some of your friends or family members, we understand how you feel. We don't think that the balance disorder is in your head. It's not just something you have to get used to or something that you have to live with. When you have a chronic balance disorder, you need to be calling our office. I'm not going to lie to you, there will be changes to your diet and lifestyle. If you're not prepared to do this, then please don't waste your time, don't waste your money on this recovery program. But if you're ready and you're willing, then we will be treating you both neurologically and metabolically. So if this makes sense to you, then please call our office and book an appointment. Insurance may cover a portion of it, but we also do offer some financing options. We will be testing you, treating and retesting you throughout the program. Now this may take you 6 months, it may take 12 months, but what you have to remember is this is a chronic problem that's been going on for a long time, so it's going to take some time to fix it. What I have to ask you is the following. How has this affected your life? What is your life worth to you and your loved ones? Is it worth $5,000? Is it worth $10,000? Where do you see yourself in 3 to 5 years if this doesn't get changed? Are you committed to getting better? Now remember, this takes work. And I want you to know once again that we are affiliated with Dr. Michael Johnson at lifechangingcare.com, and you can check out the numerous patient testimonials right there at lifechangingcare.com. And when you're ready to make this commitment, please give us a call back at area code 802-893-1070 to go ahead and book an appointment. So once again, I'm Dr. Aubrey Tager, and I'm willing to do whatever it takes to help you get your body better. Are you? Thank you.